Hi everyone. So at first I want to do an instructional video on lung auscultation, and then I will show you how your skill check video should look, okay? So first I want you to take out your stethoscope, get it out of your box, make sure you have all the plastic wrap off, and then get to know it a little bit more, right? The earpieces, whenever you're listening, should point towards the nose. When you first get them out of the box, they're usually pretty flat. So go ahead and rotate them, and then you would stick them in your ears like so. And then also at the end, keep in mind you have the diaphragm side, and then with the turn of the wrist, you can listen more to the bell side. It is a one-way valve that only listens to one direction. I want us to start on the diaphragm first. It really is best for high frequency pitches and used most commonly, especially in the lungs. I just want you to use that. But for the heart sounds, we'll start with the diaphragm on all four. Then I want you to switch to the bell and listen to all four again, just noticing the differences, right? You can really hear the lower pitches with the bell, especially the S2 of the atrial and pulmonary valves. So then, again, just a few more points, and then I'll show you what to do with your video. So our dear friend Connor here is helping us today, and it might be hard to see, but I put the spots on here that I want you to look at. You're going to come to their right side. You're going to find the angle of Louis, right? That is, I want you to palpate that first rib, then go down to the second rib into that space, and that will be your aortic valve, right? So that is where you will hear that. Now, keep in mind, this isn't exactly atomically correct, but it's been found to be the best part for auscultation, for us to listen to the heart sounds. So first, you're going to listen to that aortic valve, then you're going to cross the sternum into the pulmonary valve. Then I want you to go down past the third rib into that space in between the third and fourth for that tricuspid, and then that mitral valve, right? Go past the fourth rib, slightly lateral, and you will find that mitral valve. Keep in mind, a mnemonic if you need it, APTM, right, is all physical therapists move. Hopefully that'll stick with you. All right, so in just a moment, I'm gonna pause and restart the video. We'll make sure it has all the components, right? You wanna do an introduction, ask for permission, inform them what you're gonna do. I want you to do the palpations, really feel for it. So I'll take our little cheat sheets off here. I'm gonna palpate and listen. You wanna listen to 2 full cycles at each spot, starting first with the diaphragm on all 4. Then you're gonna switch to your bell, go back to all 4, and that should conclude your video. Okay, best wishes.